Good day, my friends. Welcome back to another coffee break program. This is the autumn in the Europe, and all the trees are multicolored and getting ready for the winter. Today, I'm going to discuss about a special condition which is getting worse in the older age of the human life, which is like the autumn. That is the dementia. Let's discuss about dementia in details today. Let's discuss about dementia now. What is dementia? And I mentioned that it is mostly related to the old age. Age is a risk factor for dementia. What happens when somebody is getting aged? It's a usual pattern of aging problem that people may lose their memory, and there would be a little bit of cognitive impairment with the aging process. But dementia is something more than that. In dementia, the memory loss and the cognitive impairment and the speech and language problem, they are more than what is expected from the process of normal aging. For an example, a person may start with early signs and symptoms of dementia by frequently losing things like car keys or their usually day-to-day used items, or they may get lost in their normal environment, which is very familiar to them, and they may forget words, they may forget the names of persons or names of items that they usually are supposed to keep it in mind. So dementia is a slowly developing process, and it starts mostly when somebody is aging above 65. But there are conditions which can happen and end up with dementia even before that in younger age. And we are going to discuss all these things in our lecture today. Once in every 3 seconds, a patient with dementia is identified all over the world. So it is very common, and especially it is very common in an aging population. So basically, dementia could be categorized in this way, and I'm going to discuss about each of these domains separately. First, dementia could be real dementia or it could be pseudo-dementia. Pseudo-dementia is the presentation of cognitive and memory impairment secondary to severe depression. When the severe depression is corrected or treated, this can be reversed. So pseudo-dementia could be reversed, and normal dementia could not be reversed. Normal dementia consists of various categories. The commonest thing after 65 years is Alzheimer's dementia. And next common is vascular dementia and Lewy body dementia, frontal temporal dementia, and one can present with 2 of these conditions, which we call mixed dementia. And also, people who has Parkinson's disease can present with dementia in their late stage. There are some other rare conditions which can cause dementia, especially HIV infections, tuberculosis, and other chronic infections. And also, you might have heard of this condition called mad cow disease, Creutzfeldt-Jakob syndrome, and its newer version also can cause dementia. That is called the spongiform degenerative disease of the brain, which prognosis is about 6 months once it is diagnosed, and it is quick deterioration. So we will discuss about these things one by one slowly. Chronic alcohol use and vitamin B12 and folate deficiency also can cause dementia. This is Dr. Aloy Alzheimer's. He was a psychiatrist and he was the first person to introduce Alzheimer's disease to the world. He was born in 1864 and died in 1915. This is the first Alzheimer's disease patient diagnosed by Aloy Alzheimer's. Her name is Auguste Data. The commonest type of dementia is Alzheimer's dementia, and it is prevalent 60 to 70% among the population aged above 65 who are diagnosed with dementia. And there are two types of Alzheimer's dementia. One is sporadic and the other one is familial. Sporadic Alzheimer's is about 90 to 95%, and familial one is about 5 to 10%. So Alzheimer's dementia is more common in female gender than male. And when somebody is diagnosed with Alzheimer's dementia, the life expectancy is about 6 to 8 years. They get deteriorated and die. And the reason for the pathological reason for Alzheimer's dementia is the deposition of beta amyloid plaques and tau protein tangles. Beta amyloid plaques are deposited outside the nerve cells, and tau proteins are deposited, tau protein tangles are deposited inside the nerve cell. We will go into the details of these mechanisms. And the other interesting thing is the disease progress starts about 20 years before the manifestation of symptoms. So the process of this tau protein and amyloid plaque deposition starts long before they demonstrate the signs and symptoms of the condition. Now we are going to get an idea about the way that the beta amyloid plaques are being deposited. For an example, this is the lipid bilayer of the nerve cell, and this is outside, this is inside the nerve cell. So as you all know, the lipid bilayer contains phospholipids, and there are some amyloid precursor proteins in this bilayer. In normal process, it helps the organization and repair of this cell membrane, and with time it goes into degeneration and get recycled. So this process is called, the chelation process is called by gamma secretase and alpha secretase. When gamma secretase and alpha secretase are present, they chop off this amyloid precursor protein in this way, in this portion, and it goes into the system which is very soluble particle, as a very soluble particle, and it get excreted. So this is the normal process of the recycling of this amyloid precursor proteins. But in the presence of beta secretase, instead of this alpha secretase and gamma secretase, when beta secretase and gamma secretase are there, and when alpha secretase is not acting, what happens is this chopping off process happens little differently, in which the leftover product, the chopped over product, is quite different from the usual byproduct, and this product is very sticky and cannot be excreted in the normal process. What happens is these chopped off amyloid precursor protein byproducts deposit in the brain as amyloid plaques. So they make amyloid plaques, those byproducts which are sticky and unable to excrete as usual byproduct, get accumulated among the nerve cells of the brain tissue. Now, these are the amyloid precursor protein byproducts which are deposited as beta amyloid outside the nerve cells in the brain, and they are called amyloid plaques. And as you all know, the normal cytoplasm of a nerve cell contains some microtubules just to keep the cytoskeleton intact. So in these nerve cells, in the microtubules, there are a variety of proteins which keep the microtubule intact, and they are called tau proteins. When there are tau proteins, the microtubules keep intact, and they work as the transport tracks for various chemicals in the cytoplasm. So in Alzheimer's disease, what happens is these tau proteins get chelated and taken off from the microtubules due to some unknown mechanism, and by that the microtubules get disturbed because the cytoskeleton, the framework of these microtubules get disturbed, and thereby the chemical transmission inside the cell get affected, and also these tau proteins get accumulated inside the cytoplasm as tau tangles. These are the deposits which are called the tau tangles. So two things happen: amyloid plaques outside the cells and tau tangles inside the cells, and these two things disturb the cell mechanism, nerve cell mechanism and its conduction, and inflammatory mediators get around, and inflammatory process happens all over there, and cell apoptosis and cell death happens, and you get the brain matter shrunken slowly, and this is what happens in the Alzheimer's disease. Normal brain is like that. If you cut it into pieces, and it has normal gyri and sulci, but in Alzheimer's disease, what happens is these gyri become narrow and sulci become wider, and brain get shrunken, and the ventricles they become larger. And this is the process in brief which happens in Alzheimer's disease, and that is how it affects the brain. You can see the difference between the healthy brain and severe Alzheimer's disease affected brain. The healthy brain is full and the Alzheimer's disease brain is shrunken. You can see the enlarged ventricles and sulcus and gyrus, they are shrunken and the brain matter is reduced. Initially, the hippocampal area is affected in Alzheimer's disease. You can see the hippocampal area in this picture. Apart from amyloid deposition and nerve cell damage, amyloid deposition can cause amyloid angiopathy, and thereby it can burst the blood vessels in the brain, and by that way also it can make the contribution to the Alzheimer's disease. In early stage of this process, which starts about 20 years before the symptom appears, patient is asymptomatic. And then with the progress, starting to lose short-term memory, and next loss of motor skills like feeding, self-feeding, dressing and all these things, and also start getting language problems, the words get forgotten and difficult to articulate properly, and all these things come. And with further development, loss of long-term memory happens. This is very awful situation. They can't remember the name of their spouse, they can't remember the name of their close associates, and further deterioration makes them more disoriented and they get lost. They can't find the pathway, they can't find the way home, and they usually get lost and they get aggressive and they start wandering. And furthermore, they go into bedridden situation, and then ultimately death can happen normally due to aspiration pneumonia, urosepsis and all these infections of the old age. And this whole process usually once symptoms started appearing, this process continues only 6 to 8 years. But long before the symptom appears, the process of amyloid deposition and tau protein deposition starts. Next common type of dementia is vascular dementia. The word vascular explains the etiology, and it is known as multi-infarct dementia as well. As you all know, the brain tissue has no much glucose storage, and it needs constant blood supply to give energy to the brain cells to function. So if the blood supply to the brain get defected due to any other cause, that can cause damage to the nerve cells in the nerve system. So this is the basis of this. Sudden onset after a stroke. After a stroke, either hemorrhagic or ischemic, the symptoms of dementia starts all of a sudden after that, and it progresses like a step ladder like this. Whenever a vascular event happens, it deteriorates further. And in Alzheimer's dementia, usually it deteriorates in a constant pattern. So and starts gradually and deteriorates in this way. So that is the difference between these two. But we get overlap syndrome, that means mixed dementia mixed with Alzheimer's and vascular dementia as well. And the risk factors. What are the risk factors? Obviously, atrial fibrillation, which causes small blood clots and shoots into the brain. It can cause micro infarct, and that can cause vascular dementia. Hypertension, diabetes, high cholesterol, and brain aneurysms. Usually when they ruptures, people die, but if there are small aneurysms, yes, and if they survive, they may develop vascular dementia. So any risk factors for vascular events can cause vascular dementia. The third category of dementia is Lewy body dementia. Lewy bodies are alpha-synuclein monomers, and they get deposited in the nerve system, in the nerve cells, and thereby uh, causing clumps of Lewy bodies. These Lewy bodies disturb the function of the nerve cells and affecting the cognition and memory, and that is the simple pathology of Lewy body dementia. Lewy body dementia is more or less similar to Parkinsonic features as well, because these alpha-synuclein monomers were found in Parkinsonism as well. That is the condition in which they found these monomers first. But the difference between Parkinsonism and Lewy body dementia is Lewy body dementia, the cognitive impairment and dementia features start first. In Parkinsonism, the motor disorders start first, and later on they develop dementia as well. In Lewy body dementia, these Lewy bodies are deposited from the cortex and goes slowly progresses into the inner compartments of the brain. This is the second commonest neurodegenerative form of dementia. The first one is Alzheimer's, and mostly their REM sleep is affected. These are the earliest features. They start sleepwalking or combating with people, or combating in their acting upon their dreams in REM sleep. So they combat and they act according to their dreams in REM sleep, and they do sleepwalking as well. They get visual hallucinations. These visual hallucinations are mostly about creatures, especially human beings or animals or some sort of animated creatures. That is a very particular feature of this Lewy body dementia. And as I said, they later develop Parkinsonic features, the stiffness of joints and rigidity, and they get autonomic disturbances as well, and they always tend to fall, and lot of falls. They are very sensitive to neuroleptics, so in case of their confusion and deterioration, aggression, we should not use things like haloperidol, because that can cause more harm than good. There is a sad situation with Lewy body dementia, because this is always not properly diagnosed, misdiagnosed. The reason is Lewy body dementia is always overlapped with Alzheimer's dementia, and Parkinsonism. So Lewy body dementia is mostly less diagnosed. So that is a sad feature of this condition. The fourth category of dementia is frontotemporal dementia. Asymmetrical degeneration of frontotemporal areas due to Pick's body's deposition. This is called Pick's disease as well. And the onset of this condition is commonly in younger persons. So around 60 or above, before 60, they can present with signs and symptoms of frontotemporal dementia. And if the frontal lobe is affected, their personality and behavior affects. And if the temporal lobe is initially affected, the language ability affects the most. And anyhow, both behavioral and language problems can appear, and it's very challenging behavior of these persons, and to the person itself and to the family. It's very difficult condition to manage clinically, and prognosis is very bad. So today we discussed about dementia, and if I discuss about the diagnosis and the treatments, this video will be very longer and it will be boring for you to listen to this. So that I hope to prepare another video, that is dementia number 2, for diagnosis and treatments. Thank you so much for listening to my dementia video. And if you have not subscribed to my channel yet, please subscribe, put a thumb up, and put a comment as well to encourage me, or to point out any defects in my lectures. And we will meet again with another video, dementia 2, regarding the treatments and investigations. Thank you.